get more from the World Health Organization, and a short while ago we spoke to Dr. Thierno Balde from the WHO Regional Office for Africa. He's currently the Deputy Incident Manager for COVID-19 emergency response, and he started by telling us about that second case of Ebola in the DRC.
We've been informed about a second case, following the first case, which were already confirmed about 6 days ago now. So this second case is a lady living somehow in the same area than the first case, and which seems to be have been, somehow a contact of that person who has died. It was definitely the first case was a baby of 2 years old, and this one is a lady of 42 years old. The different actions currently, the support of the response have been initiated with the listing, obviously, of the contact, the improvement of the surveillance measures, but at the meantime, also the vaccination. This outbreak, this flare-up of the outbreak is happening in an area where we had this previous outbreak in 2018, from 2018 to 2020. So there were already some of the resources which were, in stock in the North Kivu, in Goma, and so those are the ones which has been used for responding to this flare-up. And based on the latest information that we got from the national health authorities in the DRC, there's been a kind of linkage by doing the genomic sequencing of the first case. They have found out, a kind of relation, a kind of linkage between that case and also a survival of the previous Ebola outbreak in the DRC, in North Kivu. For the Ebola vaccination, this is a standard procedure. So it's about vaccinating the contacts and the contacts of the contacts. This is a ring vaccination. It's not really a general vaccination. Once a case is identified, so the contacts are identified and sensitized, and then they are also offered to have the vaccine for protecting them and for protecting the community, against the virus. And obviously, in addition to the close people who are around the confirmed cases, usually also this type of vaccination, in ring vaccination, target also the most vulnerable people, notably the most at-risk people, notably the healthcare workers. For the moment, those are the two cases which has been reported, and definitely the surveillance activities are going to be reinforced and improved in order to find any other additional cases, and if there is any, and obviously to take all of the different appropriate public health measures, for containing those cases. We know that we have learned a lot during the past Ebola outbreak in the North Kivu, and so definitely, all of the different resources and means will be mobilized for trying to handle and to control this outbreak with the support, obviously on support of the national health authorities.